Hospitals have accelerated the development of their innovative telehealth programs during the pandemic. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. In this Members in Action podcast, Julia Resnick, Director of Strategic Initiatives at the AHA, is speaking with Thomas Harris Jr., Executive Vice President of Operations at Gillette Children's in St. Paul, Minnesota. They discuss how Gillette Children's virtual rehab program has enabled them to better serve their patients.
To start, I think it would be helpful to get some background on Gillette Children's. Can you share a bit about your hospital and the community you serve?
Sure. Gillette Children's is an independent nonprofit children's hospital and clinic system that specializes in treating children with rare, complex, and traumatic conditions. So the institution was founded over 125 years ago as the first hospital in the United States that was dedicated to treating children with disabilities and, again, traumatic conditions. Gillette actually first came to international attention during another pandemic, which was the polio pandemic, and we led the country in treatments and care for that condition. Now, because of the highly specialized care that we offer, physicians from across the nation will refer their children here to Gillette for brain, bone, and movement conditions. Last year alone, we saw patients from all 87 counties of Minnesota, as well as every state and multiple countries. So our main hospital is located here in the St. Paul area, but we have clinics throughout the state of Minnesota, so we're able to serve not only rural but also urban patients.
That's fantastic. So I know we're here to talk about virtual care, so I'm really interested in what problem you were looking to address and how you knew that was a problem.
So prior to the pandemic, we had planned on offering virtual rehab services. However, work on launching this program had not yet begun. So when COVID hit, we knew that we needed to ramp up our virtual rehab program quickly, and we were able to implement a program in about a month. We knew that we had to do this because our kids and our children needed to continue to progress in their therapies. We did not want them to regress. And so if you go any amount of time without doing the therapies, then you don't see the progression in the outcomes that you want. And so that was really the problem that we were trying to solve, is really keeping them progressing along their healthcare journey and not regressing. So getting this program up and running was important for, several reasons, as I've already stated. First, we wanted to make sure that we were able to continue important rehab visits safely. And then second, we wanted to increase the equitable access to all of our services. It can be challenging to actually transport a child who has a disability or other physical needs to in-person appointments. This requires patients or parents to take off of work, patients to be out of school. Sometimes families have to arrange for childcare. And so we wanted to make sure that during the pandemic that we lessened this burden as much as possible so that the patient could continue their care. Third, we wanted to reduce any barriers for our patients in greater Minnesota who were traveling sometimes hundreds of miles across the state in order to get these services. So by putting virtual rehab in place, it allows them to stay at home in their known and comfortable environment and still access our care. And then finally, we wanted to reduce our patients' exposure to COVID-19. So having a virtual option was incredibly helpful for many of our families.
I'm so interested in this idea of virtual rehab, especially for the pediatric population. So can you talk more about the model that you implemented and how it works, and maybe even just like talk us through what it looks like?
Sure. So Gillette was an early adopter of virtual therapy for specialty pediatrics. Many other therapy providers launched virtual therapy offerings in response to the pandemic. But what I'm seeing in the market is some are starting to pull away from that and go back to more in person visits. But Gillette has embraced virtual rehab because we've seen the difference that it makes in our patients' lives and in increasing accessibility and equity. So, the way that it actually works is that patients and families connect with their providers via Teams. The provider is at a Gillette location or site, and the patient is in their home. So, the virtual platform allows for therapists to see into the patient's homes examine their environment, and make adjustments as needed. So parents actively do participate in the visits. They can help their child complete the exercises as the therapist is coaching the child through them. The hands-on experience allows them to better understand the exercises, and we found that patients and families are completing their exercises on their own. So it's really a win-win for both Gillette and the families. The families don't have to travel. They can do their exercises in the comfort of their own home, and we get a chance to see the normal environment. And by assessing that normal environment, the PT or any of the therapists can make suggestions on things that may need to be changed to better facilitate a virtual visit.
That's so great that they're able to get like a peek into their
Yeah,
patient's home.
yeah, it is great.
So I know that this is different than how things have usually been done, but how have patients and providers been responding to this shift to virtual rehab?
We have not collected data previously on patient satisfaction with these virtual visits, but we are working on gathering that patient satisfaction data now. But we do have some anecdotal data from our patients and providers, and what we've heard from them is that they actually love it. Again, for the providers as well as the patients, they see it as a win-win. The patients don't have to travel, and the providers also get a chance to see inside that home and the natural environment of the patient. And so for both entities, it's a win-win, and we've heard that they absolutely love it.
Do you have any stories or examples that could help this come alive for our listeners?
Yeah. So actually, the first one, there are a couple that come to mind, but we had this patient, and his name is JJ. And JJ lives in greater Minnesota and has to travel at least about 2.5 hours to actually come in to the main campus. And so one of our therapists was able to actually complete a bath chair evaluation in the comfort of their own home, and that therapist also arranged for a vendor to come out to the home to do some, further assessments. This was very convenient for the patient as they didn't have to make that almost 3 hour, travel or journey into the city. They were also not aware of all the types of bathing equipment that we were aware of. So we were able to actually educate them through that visit. They only knew of one type of equipment from their school team, and so the therapist was able to recommend even more options. So again, what brings it to life here is patient didn't have to travel. They got the care that they needed in the comfort of their own home. They were exposed to more resources than they thought were actually available, and then also the coordination of a vendor to come out to their home.
Fantastic. I know that you're just starting to measure patient satisfaction, but do you have any data about the impact of the work, particularly in terms of outcomes or the patient experience or cost?
Yes, yes. So in 2021, Gillette served 4,107 unique patients and 11,000 or a little over 11,000 virtual visits, including over 3,000 rehab virtual visits. And so Gillette also served patients from more than 17 other states and countries. So then when we look at the outcomes, the program has allowed us to take Gillette's care model to an expanded geography and provide care to kids that need it that would not normally have access to our services. So from an experience perspective, again, we are continuing to work on gathering that patient satisfaction data. But as I stated earlier, the anecdotal data that we've received is that patients and providers actually love it. So from a cost perspective, offering the virtual therapies is not about lowering the cost for us as an institution, but it's about reducing the cost for the patient and family. So by offering these virtual appointments, we're able to reduce the costs that are associated with travel, taking time off work, arranging for childcare for other kids, etc. And so, even though there is still a cost to providing this virtually, really it does lower the cost for the patient when you think about all the travel that goes into it.
And that is so hugely important, I'm sure appreciated by your
Yeah,
patients'
yeah.
families. So, since you've started this, what have you learned that you could share with others?
So we've learned that virtual rehab has advantages over a regular clinic visit. So for virtual rehab, it allows the therapist to see a patient's home, helping them to identify how the patient can get around in their natural environment. We identify potential fall risk and any modifications that need to be made so that we can make sure that their home environment is safe for them. Also, virtual rehab encourages parents to actively participate in their care. So, because this is a more hands on model, this helps them to do the therapy on their own in between visits with their parents. So, we've heard from parents and the patients that they feel more comfortable and better understand their child's therapy and needs because it is a hands on model. So, those are the things that we've learned.
Fantastic. And what's next? What's next for Gillette Children's in this space?
So, this is an innovative program that is benefiting patients and families. Now, because of this, we were recognized by the International Hospital Federation and the World Health Organization. So, the rapid and significant expansion of digital health offerings will continue. So, in the short term, we are going to be focused on expanding our virtual care and the virtual rehab for patients in rural Minnesota. This investment in virtual care and virtual rehab will continue to grow and expand to serve patients outside of Minnesota and throughout the United States. And so for us, we are looking to expand this outside of just Minnesota. And that is the beauty of virtual. So you can connect with patients anywhere to provide these services.
That is wonderful. And Thomas, thank you so much for sharing your journey with Gillette Children's and implementing virtual rehab. I think it's a really exciting, promising model, and I look forward to seeing how this work evolves in the years to come.
We are so excited about it. This is truly innovative. But that, of course, has been the history of Gillette. We have been market innovators for over 125 years now, and we are celebrating our 125th year this year. And what better way, there's no other better way to celebrate that than to roll out innovative services like this virtual rehab program. So we are excited about it.
Awesome. Well, happy 125th birthday.
Thank you.
And here's the next 125.
Yes, 125 more.